Welcome once again to our neurosurgical colloquium brought to you by the SOPEN, Society of Peruvian Students of Neurosurgery and Neuroscience. Today we have the pleasure to present to you Professor Giuseppe Lanzino. He is from Joseph and Barbara Haskins Professor of Surgery and Professor of Neurological Surgery and Radiology at Mayo Clinic, Rochester, Minnesota. We're going to talk about writing and publishing medical papers today. So Professor Lanzino, whenever you're ready, you can begin.
Hello, I am sorry. I need, can you please allow me to share my screen so we can... Mauricio, can you let me share the screen?
I don't have the option, doctor. I think Will is the one managing everything because I don't have the option here.
Okay.
There you
go. Mauricio, you are now the host.
I know.
Okay.
Okay. Can you try now, doctor?
Hello, and thank you, everybody. Sorry, I am. We have some emergencies ongoing, so I apologize. I might have to go soon, but it's a pleasure for me to share some practical tips on how to write a scientific manuscript. I think that the key to success is really to keep it simple. And one of the important things to understand is that particularly scientific writing, medical writing, there is a scheme that it's important to follow. And once you learn the scheme, then it becomes fairly straightforward. Now, you might ask, when should I write a manuscript? Well, I think it's sometimes you might see a case with a particular novel angle. I think that we write when we have something new to share. Sometimes it's a new technique or a modification of an old technique. There is a great role for reviews, even though nowadays it's very difficult to keep track because there are reviews of everything, but there is no question that it's important to be able to access a comprehensive and updated review of the literature on one topic. So sometimes writing a review has an important role. Then in our field, often it's retrospective personal case series with the novel approach, technique, or to share some of our results. Now, the mistakes that we often make is that we start immediately with the data collection. We have we have already something in mind, but before we start, it's important, like anything else, to do your homework. Do a comprehensive review of the literature. Make sure that there is a need and that you know what is known about the specific topic that you are about to write, right when you start writing. And then as you are getting started, it's important to think and rethink about the project so that, you in your mind, you start perfectioning it. So, as I said, the scientific manuscript writing has certain rules and follow a scheme. The title, it's what's the purpose of the title? As I said, you need to keep it simple. The purpose of the title is to get the reader attention, to make the reader interested in the topic. And you should be able to summarize in no more than 6-10 words, really what is the main message of the manuscript. And, there is some people like to be flashy. I personally like to be fairly plain and straightforward. And in a few words, say exactly what I'm trying to show. So, you know, the title is something that you work continuously and you perfection and you change, and usually something that you can think about. You don't need to sit down and write the title, but you can think and finalize, you know, really as you are driving back and forth from work. This is it's a little bit of a flashy title. This was a review that we wrote for neurosurgery in the late 90s, and it was basically about historical overview of neuroendovascular therapy. And here, since this was a review, it was a historical overview, so not strictly a scientific manuscript, I thought it was important to have a flashy title. And as you can see, treating complex nervous system vascular disorders through a needle stick. But then, you know, in the next section, origins, evolution, and future of neuroendovascular therapy, I specified exactly what the manuscript was about. So nowadays, the title has become very important because it is critical for in the word searching, and so there are tricks that I still personally don't understand in order to make sure that your manuscript comes up in some of the library searches. Then the next step is the introduction. Now, as I said, it's important to understand that medical writing has rules. So the introduction has a specific format. What is the purpose of the introduction? The introduction is the purpose is to make the reader interested in actually keep reading the article. And to justify the rationale, basically explaining why you did what you did. And as I said, the introduction has a funnel structure, and I will elaborate a little bit more shortly about what I mean by this funnel structure. Introduction should not take long. Once you have done your homework, it should not take more than 1 hour just to put it down. So now the mistake that many writers do is that the introduction is not supposed to be a complete review of the literature. The introduction is you need to give the prior authors some credit, because you like to state what's known in the topic and where you are going to fill a void. But you really, again, the introduction is not supposed to be a review of the literature. You don't start saying in 1896 blah blah blah. And again, that's a mistake that many writers do. So what I mean by a funnel structure, well, you start the introduction, as I said, as a scheme. You start with the very broad statement, and then every single subsequent sentence you work on narrowing down the original statement to narrow down the focus, and the final sentence is usually in order to show, or in order to study this, we did that. So again, you can be very simple, very explicit. Most of the times, no more than 2 sentences. Just look at some of articles in New England Journal of Medicine, Lancet, and then you will see that there is the introduction as this funnel structure, where you start with the broad statement, and then every subsequent sentence you narrow down until you get to the point and you say, because of this gap, we studied this. As I said, you need to give credit to what other people's work, but you really need to mention a few of highly relevant and closely related papers. But again, is not meant to be a review. And then in the last sentence where you say in the current study, so you need to be specific, you narrow even down. In our study, in the current study, we did this. And as, you know, it's important that really the last sentence, the last line, is basically a restatement of the purpose statement from the abstract. You can see that I went through the title to the introduction. I left the abstract last because the abstract you can quickly formulate once you have the rest of the manuscript ready. Now, I'll give you an example of a funnel structure. This is a report of a few cases of patients with arteriovenous malformations that rupture during pregnancy, a management dilemma. So this is the title. And so the first statement is rupture of an intracranial AVM is a rare but serious condition that can occur during pregnancy. So this is a very broad statement. Second, when it occurs, it presents particular problems in a situation where both preservation of the mother's life and the fetus well-being are required. So you start with the broad statement, you narrow down basically saying it's rare, but when it happens, there can be some conflicting problems to solve. One is number one is preservation of the mother's life, and then second most important thing is to try to preserve the fetus well-being. And then you try to justify why what you are reporting is of interest. Why? Because this situation is rare, only a few cases have been reported, and there is no center that has a large enough series from which you draw definitive conclusions. So you have defined the problem, you have defined the management dilemma, then you say there are no large series, and therefore 3 cases recently observed at our institution best summarize the management dilemma encountered in treating such patients. So, and then, as I said, this was basically a small clinical series of 3 patients, 3 women with AVMs that ruptured during or pregnancy, and each one was managed differently because it presented different management dilemmas. So you can see how basically the introduction, it's number one broad sentence. Number 2, you narrow down. Number 3, you basically justify why it's important what you did, and then you say exactly what you did. Sorry, was a page. Then we go to the material and methods. The material and methods is, again, once you have done the work, you just need to describe in a detailed fashion and in a rational fashion exactly what you have done. Of course, the material and methods are for truly experimental basic science studies. The material and methods is for sure the most important part of the manuscript, because anybody who reads the paper, in theory, should be able to duplicate your experiment and to obtain the same results. So for truly experimental basic studies, material and methods is the most important part. But the material and methods are very important. As a matter of fact, as a reviewer, that's the part of a manuscript that probably I analyze more in details, because if the material and methods, they have fundamental flaws, then the results they might not even make sense. So In the material methods, you describe in a rational and consequential fashion exactly what you have done. And again, this is something that you don't need to spend a lot of time. You have done the work, you just sit down and you do it. It should not really take more than an hour for most of our papers that, as I said, are often single case series or modification of an old technique or a relatively new technique. So that takes us to the results. Now, the results, it's important that the results is not supposed to be a phone book where you state in the text. If you write a manuscript, you are lucky if you have two, at the most, three important messages to communicate to the audience. So the results is not supposed to be a phone book, a list of a lot of details, but what you need to do in the results, you need to spell out in the text the most important results. The most important, there are basically the most important messages of your study. And it's important to report the results in a well-organized and logical manner. Particularly for experimental studies, but in general, it's important to summarize as much as possible the results in tables. For example, in our series, there were so many men, so many women. Mean age was 42. Period. Demographics details are summarized in table 1. Boom. Next. The most common risk factors in our patient population was hypertension, present in 57% of patients. Risk factors are listed in table 2. Next. So the way you are describing, you are spelling out in the text what are the most important aspects of your findings, but all the details are summarized in a table, in a figure. Nowadays, because journal space comes at a price, nowadays many journals do use supplemental material that is available only online. If you've done your work and you know the results, this part again should not take long at all. So you see how writing a manuscript, it's really not that difficult. Yes, you need to do your homework, but then if you decompose, each part really should not take that long. And again, here in the results to summarize again, to avoid the redundancy, to stress what are the most in the text, what are the most important findings of your findings, and try as much as possible. If you use a numerical result, make sure that you mention the denominator and the percentage, because otherwise 20 patients, or 20 of what? So it's important to again, it's you have to summarize in an intelligent and consequential fashion what are your results. So if you use a numerical value, make sure that you use the denominator, and even more important, that you have a percentage. Now, this is the part really where it requires a little bit more work, and that's the discussion. But even the discussion, it really follows a fairly simple formula. So paragraph number 1 in the discussion, again, look at the New England Journal of Medicine or Lancet. What did you find? In the present study, we found that the incidence of AVMs that rupture of hemorrhage from AVMs during pregnancy, it's 1 in 100,000 pregnancies. The mean age of patients who presented with AVM rupture during pregnancy was younger than the overall populations of patients with pregnant women in the general population. So the first paragraph of the discussion, you stress, you summarize what you find, and then you go on to say why this is important. Well, this is important because it's an uncommon condition, but it's something that should be strongly suspected when a young pregnant woman presents with intracranial hemorrhage. Then in the second paragraph, you go on and you discuss your findings in relation to what is already known in the literature. You say so-and-so in a study done several decades ago in 1930, it suggested that the incidence was much higher than what we have reported. However, our study is more recent, and a lot of technological advances have occurred, which might have made the diagnosis easier, and therefore this might justify the difference. In the second paragraph, you state what other people have found and how your results are different or the same, and if they're different, why they're different, and if they're better, why they're better. Then the third paragraph, and of course you can use additional paragraphs, but the third paragraph you say, what are the limitations of your study? And you can say, well, our study represents a single institution, but then you try to minimize the effects of that limitation in the sense that you explain, yes, it's a single center institution. At the same time, our center, it's a large referral center with recognized expertise in this topic, and therefore we tend, something like that, to say, yes, it's a limitation, but there are some potential pros despite these limitations. So again, if you go and you study some papers in New England Journal of Medicine, Lancet, which are definitely some of the best medical journals, you will see that most authors in the discussion, they follow this scheme. First paragraph, they state what they found. Second paragraph, they discuss their findings in relation to what's available in the literature. And then there is a paragraph with the limitations, and then you can say, okay, what comes next based on our observation? What's known in the literature? What do we think should be studied? What do we think we should look at next? And then you have a conclusion statements which in 2 sentences summarize what are the most important findings of your study. And as I said, most studies, if you have 2, at the most 3 main messages, that's usually more than enough. It's difficult to find medical papers when there is more than 2 or 3 messages. So I apologize. I have to go, but I mean, we can definitely continue the discussion and take it from here, because then, of course, you do the homework, you write the paper following this scheme and following these practical considerations. But then the part that is really most important and at times painful is that you read it. I think if I personally find that if I read it aloud, it helps me to improve. And then there is a lot of time, actually much more than you spend writing a first draft, where you really you make it perfect. You change a word, you eliminate a sentence, you move a sentence. So there is a continuous work that takes place where you try to improve and you try to make it perfect. And the other important pitfall to avoid is that I remember when I started, I thought that if the paper was not long enough, then it was not a good paper. Instead, you just, this is scientific writing, it's not literature. So you just say what you need to say. The more succinct you are, the better it is. Of course, in the discussion, you have to be comprehensive in the sense that you have to make a good case to discuss and to educate the reader about the importance of your findings in relation to what is known. And then based on what you have added to the literature, where we go next. So I apologize, but with Duriel and the rest of the team, we will find a time, if not this week, next week, when we can continue the discussion while we have all this basic concept present and fresh, and then we can have a nice lively discussion. But you can see it's not that difficult. You have to keep it simple. Most people never write because they think it's very difficult. And the other thing is that you cannot think. When you think and say, oh, it's so difficult, I'm never gonna put this together. But when you sit down, you take 2-3 hours and you just write it down. Write down what comes through your mind. And then you can improve and make it better, considering some of these basic concept and the fact that there is a basic scheme that you must follow. All right, so Mauricio, you can moderate a discussion among yourself. Unfortunately, I have to go, but as I said, I will make sure that we coordinate a time, and I apologize to all the other participants, but I think we covered already a lot, and the next discussion, the next colloquium, we can answer questions and go into some more practical tips once we have this overall overarching scheme.
Yeah, Professor, don't worry about it. I think we can reschedule the rest of the session without a problem. Thank you.
Of course, Doctor. Thank you. Also, for all our participants here, let me give you big news for today. We are arranging and we are putting in loading or cargando our second International SOPEN Congress. So we hope all of you go in there. We hope all of you stay in our Congress. Tanto nuestros queridos amigos latinoamericanos, nuestra preciosa comunidad latina de neurocirugía, estudiantes y residentes, además de médicos attendings, y a lo mismo de nuestros colegas internacionales. Sin duda, esperamos poder contar con la presencia de todos ustedes a nuestro evento tan bonito que está siendo auspiciado por la Sociedad Ecuatoriana de Neurocirugía, la Academia Brasilera de Neurocirugía, la Asociación Argentina de Neurocirugía, y hace unos minutos nada más tuvimos la confirmación del auspicio del Colegio Mexicano de Neurocirujanos. Sin más que decir, muchísimas gracias a todos y esperamos se puedan unir también a nuestros grupos de WhatsApp y Telegram. Por favor, todavía no se vayan. Not go yet, sorry. We will pass in the Zoom chat our Telegram links for letting you know where we will do the lectures. Y vamos a también pasar por este mismo Telegram lo que vienen a ser todas las lecturas, todos los siguientes eventos, para que ustedes puedan tener más, puedan tener el mismo contenido neuro dentro de un solo grupo de Telegram. Por favor, en unos minutos vamos a pasar este link y finalmente agradecemos a todos ustedes por estar dentro de nuestra querida reunión, a nuestros queridos amigos de Colombia, a nuestros queridos amigos bolivianos, Esperamos a todos verlos ahí. Estamos organizando una cosa muy bonita y espérense más sorpresas todavía. Eh, Ahorita mismo, si no me equivoco, se están pasando los links de Telegram. Y también, como no, por el mismo Telegram también se van a reagendar o we will go to reschedule de Colloquium. Vamos a reagendar el mismísimo coloquio para que puedan tenerlo y así no tener el mismo este desorden en muchísimos grupos. So, you can join this Telegram group, the only one Sopen's group, besides the Sopen lectures, aparte de las Sopen lectures. Así que ahí lo tienen. Díganme, por favor, si lo pueden encontrar, si está en el Zoom chat. Muchas gracias, gracias a ustedes. Aquí enviamos el Zoom chat. Ok. Aquí lo tenemos. Listo. Aquí pueden entrar a nuestro grupo de Telegram. Los demás grupos van a ser descontinuados. The other groups will be stopped. So you can go here for the next lectures, the next colloquiums, and next courses and congresses. Muchas gracias. Gracias a ustedes. Okay, excelente charla. Gracias a ustedes. Saludos de Argentina. Saludos a nuestros queridos amigos de Argentina. Gracias a todos, de hecho, de que la Asociación Argentina de Neurocirugía nos está apoyando. Son muy buenos allá, muy lindos. Gracias por hacer esta comunidad estudiantil de neurocirugía mucho más grande. También veo que están nuestros queridos amigos de Estados Unidos, Barbos, nuestros queridos amigos de Bolivia, Emilia, Mauri, que son grandes amigos. Stephanie también, de Bolivia, ¿no? Entonces, sin más que decir, muchísimas gracias a todos. Espero ya todos puedan tener el link. I hope all of you saw the link of Telegram group in the chat, in the Zoom chat. También lo vamos a pasar por lo que vienen a ser los canales de YouTube y también por los mismos grupos que van a encontrarlos. Ok, so muchísimas gracias. Mauricio, anything else? Paco?
For me, nothing else. Just thank you and sorry for the inconvenience. We will reschedule the rest of the session. Don't worry.
Yes.
These things normally happen with neurosurgeons and they're really busy people. So we'll get it finished. Don't worry.
Okay. See you, everyone. See you the next colloquium. See